Mothers can listen to their favorite music during elective Caesarean deliveries at KKH in a bid to reduce pain and anxiety. It's called the Healing Tunes program and is the first of its kind in Singapore. To tell us more, we have Associate Professor Sng Ban Leong, head of the Department of Women's Anaesthesia. Now, Professor, I take it this is a precise science, so you need to talk me through how this works. How can you measure a quantifiable response in women under Caesarean as they respond to music?
So our team, thanks for the question. So our team conducted a research study that involved 108 patients undergoing elective Caesarean section. So what we found was that anxiety was actually very prevalent in about 7 out of 10 patients. So with this music-based intervention or healing tunes, their mood states improved significantly. So for us, what we found was that quantitatively, anxieties were halved and something called pain magnification scores were reduced by about 35%. So pain magnification is when an individual thinks of the pain in the worst possible outcome, and the patient will then feel helpless or hopeless, making it difficult to cope.
Professor Sng, a Caesarean section is a common operation here in Singapore as well as around the world. Apart from your study, similar ones have been done whose findings support this positive effect of music therapy for pain relief. But what makes the elective C-section operation particularly suitable for music therapy?
So that's a very good question, because most expectant mothers are given spinal anesthesia during elective Caesarean sections. So during the procedure, they will actually be awake. So therefore, they may feel anxious and may think of possible negative pain experience. So we want to improve this. And therefore, what we have come up with in the hospital is that we developed this music-based intervention or healing tunes for patients undergoing specifically for elective Caesarean section.
Professor, I've never had Caesarean surgery, but I expect it probably is something one would naturally be very, very anxious about. And I'm sure it's very, very painful without a proper anesthetic. So I'm sure music would help anyway. But there's a suggestion from your study that music intervention also helps with recovery outcomes for women after they give birth. Are you able to quantify this as well in your research?
So things that are not in our research, but things that what we know is that patients who are actually generally very anxious, they would tend to have higher pain scores after their surgery. And with this increased pain scores, there's always a higher risk of having persistent pain and also a higher risk of postnatal depression. So that's why we thought that that's something that we really want to address at the start. And that's why we came up with this initiative to reduce anxiety in patients in the first place.
So those anxiety levels were measured at different stages of the C-section process. Why is music more ideal, if it is more ideal, than medication as a way of managing all that pain and anxiety? And who usually opts to use music rather than medication?
So Caesarean section is actually a very, very specific, and I think that's something that we need to understand, is that in Caesarean section, things that because the mother's actually delivering, so therefore, as part of surgery, we try to reduce the medication in the bloodstream. So therefore, things that at the start of the surgery and prior to the surgery, there's very little opportunity to actually give medications because that may actually affect the baby. And of course, things that as part of our clinical care, we will also want to provide, talk to the patient to make sure that they are very well, and we explain, about the procedure. But what we found was that on top of this music-based intervention adds on to what we do and basically increases the relaxation and also adds on to the benefit of alleviating anxiety. The reason for why this happens in our program is that patients actually get to choose the music that go along with the Caesarean section. The reason is because our music therapists actually curate a set of music that will be appropriate. It spans a lot of genre and things that there is also caters to their patients' diverse preferences. So some examples I'll give inside the list will include things like instrumental music, relaxing, soothing music. It will also include some pop songs and even Disney tunes. So there's actually a lot to actually choose from. But our focus in this program is on patient-preferred music. So patients are encouraged to include their preferred tunes should they not be actually on the list. And what we want to do is that we want to have a holistic view from the surgical point of view. So we want that the patients to have this initiative to be done before, during, and even after the surgery for the maximum benefit.
Right. Since you mentioned this playlist, Professor, final question before you go. Is the choice of music idiosyncratic, or are there generalities that apply across the board? Every woman feels better, say, listening to It's Been a Hard Day's Night, as an example.
Okay, so that's a good question. I'll probably say in our study, we have found that there are several more commonly chosen sort of pieces, although we do not track them all the time. The common ones are things like English pop songs, some instrumental music, and also Disney tunes. But we've also had patients, recently I had one that listened to very fast-paced K-pop songs, which I was slightly worried, but the patients did actually want it, and that's part of the patient-preferred music that the patient wants. And I think I've gotten very positive remarks, positive feedback from the patient. So I guess for the music-based intervention or healing tunes, that's actually a good direction to go for.
Whatever gets you into the groove to bring that bundle of joy into the world. Thank you so much. We've been speaking there with Associate Professor Sng Ban Leong from KKH.